I'm Sarina Fazan. Taking a risk, making a difference, and changing the course of your life. Remarkable stories from people defying the odds. You're listening to Trailblazer. Hi, everyone. I'm Sarina Fazan, and thank you so much for joining us. Joining me right now is Dr. Dan Diaco. Dr. Diaco, thank you for being here on Trailblazer. Now, we talked to you at the very beginning. Well, first of all, for people who may not have watched the video, tell us a little bit about yourself.
I'm a 25-year plastic surgeon, a 4-year lawyer. I've been in town forever. I have a little bit of a radio show on 8:20 a.m., 6 to 10 a.m. every week. And I'm obviously, a man of the town.
Yes, you are. And for people, because this goes all over the country and we have people internationally that also listen to the podcast. So we are here in Tampa, Florida. Just for the people that may not know. Okay. And you were also a physician for the Buccaneers as well.
Yes, for about 6 years.
Got it, which is amazing. And your dad, who's also a physician and I am such a huge fan of his, Dr. Joe Diaco, he always brags about you and says, oh yeah, that guy can do anything. Because you're not only a plastic surgeon, you're a general surgeon as well, correct?
Well, I trained in general surgery before plastic surgery, so yes, I did both. I'm not board certified in general surgery because I just never went that path.
Mm-hmm. But
I
you've
just
done
do plastic. Yes, of course.
So we have so much to talk about. We did a video about 6 weeks ago, 2 months ago, about the coronavirus and the effects. You weighed in. Tell us what you're thinking now. We're in Tampa anyway. We're in phase 1, which means we're partially open. What's your reaction to that, doctor?
Well, I kind of have to compare today to about 25 years ago, 30 years ago, when AIDS was the crisis, the world crisis at the time. And as a general surgeon, we treated all of the indigent in the New Orleans, Louisiana, which was a very AIDS and tuberculosis riddled population.
And were you there?
I was doing trauma surgery. So we were running to the fires. We would have wards that were just filled with AIDS patients, and we get called there every day to do chest tubes and central lines, and those are procedures where blood is flying everywhere. And so we just, we were the front line at that time,
right?
And we ran into the fire and graciously helped everyone, and it was a wonderful experience. But I contrast that with what's happened over the last 2 months. And I really think it's been a shameful response.
You do? Okay, so
horrible.
So expand on that, because this is very interesting to me, because I've had people that have said, including loved ones of mine who I won't call out, but have said, well, will doctors go on the record about it? And I've always respected you, as you know.
Thank you.
So tell us about it. Tell us about why you feel this way.
Well, you remember 2 months ago, I thought that this was going to be something that we should just all exercise patience, prudence, and don't panic.
Mm-hmm.
And now 2 months later, there was nothing to panic about. We were never overwhelmed. There was never people dying on the streets. And if you look at the corona cases that have been studied, just in the last couple of days, a paper was published that said in New York, I think 61% of the cases were people that were staying at home. In that same study, 18% were nursing home cases. If you take out that 18%, now you have 82%. So that means 61 out of 82% were stay at home. That's 75% of the cases in New York were people staying at home, which shows you that the stay at home policy was a complete failure. And I think social distancing may make some sense. I think protecting yourself and being sanitary makes a lot of sense. But how we responded to this coronavirus at the helm with Dr. Fauci commanding what to do has been very frustrating for the entire country. I think it's been very toxic for society. And I think we're going to live with the scars of that for another 20 years.
So your views right now may be controversial, right? Would you?
They're controversial if you have to mandate the world narrative. And what's really frustrating in this country, when someone has an opposing opinion, now they're being censored. That was unfathomable 2 years ago. And now they're literally censoring people that have a contrary opinion. When, if you want to be intellectually honest, they've contradicted themselves. The WHO's contradicted itself. The CDC's contradicted itself. Fauci's contradicted himself. 1 week masks don't help. Next week masks are mandatory. And 1 week this medication works. 1 week this medication works. 1 week this medication works, and it makes no sense. The studies that they use to defile a therapy are weak. The studies they've used to propagate and promote some of the therapies that I think are outlandish and outrageous are horrific studies that show minimal improvements, and they're touted as the savior for mankind.
So why so much mass hysteria on it then? Why do you think?
I think there's probably 3 things we need to really look at. Number one is a lot of governments were taking advice blindly from the WHO, which has proven to be wrong on a lot of levels, and maybe a little corrupt. Number 2, everyone knew exactly what this virus was once they realized what this virus was, because this virus has been around for about 5 years.
Mm-hmm.
And it was tweaked a little bit and manipulated a little bit, and then all of a sudden it accidentally got out and then spread throughout the entire world rapidly. As it was spreading, it looked like it was going to be a 5 or 10% mortality rate. That scared a lot of governments, and I understand the fear. But the response has been disgusting. And once we realized where we were with who's vulnerable, how we can treat, how we can help, and where the resources really need to be, we didn't make that adjustment. And so now we're just saying, okay, let's just kind of relax everything. And there'll be a little spike. And then, like I said 2 months ago, in a couple months, this virus is going to be inconsequential to most people.
So what do you think, inconsequential to some people? So I definitely...
If you're old, it's a bad virus. There's no question. If you're old, if you're 70 years old or older, there's no question. It's a different disease for those over 65 than it is for most people.
And I
it's
have to
absolutely 2 different diseases.
And I have to say, you have taken many major precautions with your own dad. I mean,
we buried him. We hit him. We didn't bury him.
Yeah,
we went on to bury him, but we hit him. And my mom.
I check on your dad actually, because he says to me, my 3 boys will not let me out of the house. In fact, they'll just drop food off in the driveway, and he said they won't see me. So
they do a birthday parade wave by in April form. Yeah.
So I think that's important to note, to show that you are taking this very seriously for the population where you feel that
they're vulnerable.
Yes.
Those who aren't vulnerable, I think that there needs to be less of a fear. I finally got my antibody test this week. No exposure, no IgMs, no IgGs. And I've been working. I haven't been staying at home. I've been actually trying to, I have 4 actually essential businesses: medicine, law, I have a frozen fish delivery and shipping company,
mm-hmm.
and radio, all of which have been deemed essential businesses. So I've been able to at least keep busy. I haven't made any money in medicine in a couple months because they shut down the elective surgeries. But this has been a very busy couple of months. And also, it's been very frustrating as a scientist and a doctor, reading objective studies and then hearing the narrative about them on TV afterwards, and how they're being misled, how they're being distorted, twisted, and the narrative is just disingenuous. It's so frustrating.
And I want you to put modesty aside, because I just want people also to know that you are at the very top of your profession. I mean, you graduated valedictorian of your class. You also were in the top percentage, correct?
I was first in my class in law school. I was near the top of the class in medical school.
And valedictorian
in high school. Mm-hmm. So I'm not just a random guy.
And I want, and that's why I said let's put modesty aside. I want people to know that your opinions, that you have studied this, you've studied it quite well.
It's based on my education, my training, my experience, and my research.
So what do you think should have happened, taking a look at this?
I think
Did you agree with the stay-at-home order then?
I think the stay-at-home order for a week or two at the very beginning made sense. And then I think it should have been relaxed very fast. Once they realized that staying at home made no change in the increases of cases, they should have said, wait, this isn't working. We need to do something differently. And now New York is still like a ghost town. And some of these towns are just decimated. But what we're not really thinking about is the societal scars that we've created. The scars of relationships, of businesses, of finances, of there's going to be dead towns. Not only are there companies going out of business left and right, people are fighting, they're hurting each other, there's suicides, there's divorces all over the place. I'm hearing breakup after divorce, after domestic violence, after crime. I'm hearing about all these things, and the police aren't responding to anything because they don't want to do anything unless someone's getting killed. They are hands off right now. So nothing's being reported as a crime. Nothing's being prosecuted as a crime. The courts are all backed up, and doctors are backed up. There's a lot of people that have been needing things that aren't an emergency, but really aren't elective. And people are putting off even chemotherapy because they're afraid of going to a hospital or they're afraid to go outside. People aren't eating properly. It's the collateral damage has been just monumental, and it's so unnecessary.
So right now, with 25%, with restaurants anyway, 25% capacity, you have restaurants open, you have to be 6 feet apart. Do you still feel people should be, though, social distancing, sanitizing always? I mean, that doesn't boil down to the coronavirus. I think that's a great habit for us to always, wash our hands.
And even I'm guilty of touching my face. I'm just touching my face as I talk to you. So, I do think hand sanitizing is appropriate. I do think, keeping a little bit of a distance from people is appropriate right now. But, when I walked in here, I didn't shake anyone's hands. And it's so foreign to me not to do that and to say, hey, I just don't want society to be like that forever. I see 1,000 people running on the streets and walking and riding bikes and outside, but they don't talk to you.
Right.
2 months ago, if there was 2 people walking up the sidewalk, they'd say, hi, how you doing? People have blinders on. It's like we've destroyed socialization. It's bizarre.
It's sad. Bizarre. I mean, and the isolation is so hard.
It's literally killing people. It's killing relationships. It's killing finances. It's killing businesses. It's killing towns.
The emotional ramifications, I know. But right now, do you think it's more the image or like to shake someone's hands? Do you think it's okay to do that, or do you think there's just too much, the image of shaking someone's hands or the backlash?
It's the backlash is interesting because people will actually get shamed or canceled for shaking a hand. It's unbelievable. I mean, it's without words. It really is without words.
From a medical standpoint, though, do you think that we still should practice social distancing from a medical standpoint?
I think from a medical standpoint, we should still be protective for a little while longer. If I was in charge, do you want to know what I would do?
Mm-hmm. Yes, I do want to do.
I'd put the whole country on Plaquenil.
And what is that? Explain.
Hydroxychloroquine.
Okay.
Because here's why.
That's the mosquito.
Right. The malaria medicine.
Okay. Yes, the
I'd
malaria
put
medicine.
everybody on it on a low dose, and I'd have them all, follow up, and I would let it go, and I would put everybody out there. And if that was inappropriate to the world, then I would say, listen, as soon as you have a symptom, start taking it. Because the countries that have a big population on chloroquine and hydroxychloroquine aren't getting beat up by corona. It's a prophylaxis. Fauci himself knows that the anti-malaria medications are prophylactic and are successful in treating. He doesn't want that to be out there because he'd rather there be this magical vaccine, which we know, despite the flu vaccine, 20 to 80,000 people a year die, despite the fact that we give millions and millions of flu vaccines every year. Mm-hmm. Not to mention vaccine injuries. And I'm not an anti-vaxxer at all. I know vaccines are very appropriate if they're done in a measured and scientific way. I think that everybody waiting for a vaccine before we can relax the world's restrictions is, again, just impossible. Impossible. And now they're saying, oh, there's going to be a vaccine for doctors in September or late August. And then everybody else gets another vaccine around Christmas time. Well, I mean, do I really want a vaccine that's been tested for a month, 2 months? Do we know it even works? What are the side effects? If you give it to 1 million people, how many tens of thousands are going to have a reaction to it? And then, does it really matter? You know, I got flu shots every year for 15 years. About 10 years ago, I stopped taking it, and I keep Tamiflu with me. If I get sick, I take the Tamiflu. And then I don't get sick. I don't get sick. I didn't take a flu shot this year, because apparently if you took a flu shot this year, you're even more susceptible to the coronavirus.
So what would you say? So speaking of the vaccine, I want to go back to that. And when you were talking about perhaps giving doctors a vaccine in the fall, how long do you feel a vaccine should be tested before it is appropriate to give somebody?
I mean, wouldn't you think 4 seasons? A year? Maybe a year? Just to see, make sure everyone gets through a year without a problem, let alone 5 or 10 years like they really should be. But now that as soon as they have anything that even looks like a vaccine, it's going to be rushed to the front. It's going to be mass produced. It's going to be mandated probably. And you're going to see tens of thousands of vaccine injuries. I guarantee it.
Well, so you have you have very strong opinions on this. What would you say to the people who sadly have lost a loved one to the virus?
My heart goes out to them. But if you look at the numbers, they're almost all old people. They're almost all people that have had other things going on. And a big percentage of those people didn't die from coronavirus. They just happened to have that coronavirus on board when they may have died from something else. So I don't trust any of the numbers. And I think the numbers have been used to be misleading, to create fear, to create panic, to create compliance. And as soon as the numbers don't match the narrative, then they give you different numbers. And so I'm mesmerized by how America, for 6 of the last 8 weeks, just took it. Now you're seeing people that are doing their own research, that are reading between the lines, that are thinking, wait a second, these guys said A a month ago, B 2 weeks ago, and today they're saying C, and they're contradictory. Why am I trusting these people to tell me what to do when they're not giving a consistent message? You know, when the Surgeon General said, don't wear a mask, and he says, okay, now you can wear a mask. Now I have to wear a mask. Well, how do I trust this man? When the CDC or the WHO says the same thing about masks, how do I trust that entity if they're contradicting themselves?
Do you wear a mask?
I wear a mask sometimes. You know, in this kind of situation, we're about 6 feet apart, so we should be good. If I'm working on someone, I'm in their face, then yes, I do wear a mask. But, you know, I wear a mask for a living.
Right.
You know, I don't wear a mask when I'm driving my car. It's nonsensical.
Do you feel people should wear a mask when they go grocery shopping or to the mall? Okay.
No. I think they should wear masks if they're in a close, confined area. If you're going to be in an elevator, maybe a mask would be helpful. You know, if you're going to be in a crowded mall or something like that, and there's people like, you know, passing and bumping and things, then it should probably, you know, a mask may make sense, maybe. What really needs to be done is mass disinfecting. And so if we're so scared and this virus is so hardy, then why aren't the municipalities disinfecting everything every day? Because if you remember, the early video from China showed them with industrial disinfecting machines, big trucks, big guys with backpacks, spraying down everything multiple times. That hasn't been done. Now let's look at New York. New York's where the worst cases were, the most cases were. 2 things I want to say about New York.
Okay.
Elevators.
Lots of elevators, right?
You're talking about 1, 2, 3, 4, 10 people in a 5x5 box, a 6x4 box. That's disgusting. If you want to talk about social distancing and protecting yourself, an elevator is the dumbest thing in the world. They have their own little air system, so you're breathing everyone's air. People are touching buttons. I mean, if one guy's sick in an elevator, everyone's going to be sick in an elevator. So these cities with a lot of elevators are the ones seeing the biggest problems. If you got high rises, you got problems. Florida doesn't have elevators. Very few buildings in Florida have elevators. Most buildings in Florida are 1 or 2 stories.
And we're so
In Tampa Bay.
fortunate. Yeah, and we're
Tampa Bay.
right, and
Now-
we're very fortunate to be outside so much as well.
Absolutely. And restricting the beach, again, nonsensical. But let's look at Miami-Dade counties. A lot of elevators, a lot of big buildings, a lot of apartments, a lot of condos.
So
Those are the bad things. There should be a study looking about elevator and the disease.
and the disease and how many people are getting it because of that close contact.
Absolutely. Another problem with New York was in Florida, as soon as we saw that the old were the most vulnerable, we protected them. In New York, they were literally sending people with positive tests back to nursing homes, where they spread like wildfire to a very, very
Because that's a population.
vulnerable population.
Yeah, it's
Right.
a very vulnerable population.
And so, the other reason for shutting down elective surgeries and cooling everything off was to make space in the hospitals, which we did. We went from most hospitals being about 85% filled to most hospitals about 50% filled. So we did free up those beds. I thought that was reasonable at first.
Mm-hmm.
And, we wanted to make sure we had all these resources, and I thought that was reasonable at first. But then, as you saw, New York wanted 40,000 ventilators. They barely used any of the ventilators they already had, let alone needing extras. And no one was sharing ventilators. There was never this ventilator shortage. In fact, some doctors think that the ventilator is the worst thing you could possibly do to a patient with coronavirus. Some people think it's actually contraindicated because it makes the disease even worse.
Do you think that? Or do you have to take a look at it a little bit more?
I can't give you, I haven't seen that data, but
Okay.
it certainly seems that once you're hooked up to a ventilator, it's a death sentence. You're done.
So
They can't get you off of them. That I know.
would you take a look at that and maybe we can ask you that? Because
Sure.
like when you study that data and we'll revisit
They're
that
not,
question.
they're not going to do that study. You're not going to see that study because they don't want that out there. You're going to have to read between the lines and see the numbers. But when a study shows like a 3% improvement on a drug that costs $1,000 a dose, like, oh, we have an improvement, we have a potential cure. But then you have a drug that costs $2 that may actually be saving thousands of lives. And in some of the states where the death rate has gone down significantly are states where they've actually been using the hydroxychloroquine. And so it was such a vilified, by 2 studies, vilified it. A study in Brazil that was giving high doses that were causing problems. Stupid. We've been using these drugs for 50 years. We know high doses cause problems. So that was a dumb study. It was canceled. It was stopped. Everyone says, oh, look at all those side effects. High dose. Dumb. The second study that showed that it may cause an increase in death was a retrospective chart review from a VA where the median age was 70 years old. The youngest patient was 59, and the majority of the patients were Black, African Americans. And they were using, if the pharmacy had a code that the patient's bedside received any dose of hydroxychloroquine or any dose of azithromycin, then that was counted as someone that was on it. Doesn't talk about if they got it when they were admitted, if they got it 2 minutes before they died, or if they even got it at all. Just if it was ordered, that was counted as a treated population. How can you study that? You have no idea. And most of the people that talk about like hydroxychloroquine at the beginning, when you're first getting symptoms, it can help improve, help lower the amount of viral shedding, shorten the fevers, shorten the sickness, and get you better. No one is saying that should be done the day before you would normally die, and that's going to make a difference. I mean, you could have the best chemotherapy in the world. If you have breast cancer and you catch a tumor that's this big, you can cure it. If you have breast cancer and the tumor's now this big, you die every time.
Right.
Doesn't matter how good your therapies are. So as this infection is spreading and your immune response is blowing up out of proportion, there's a window to treat. And if you don't catch that window, then these other secondary treatments may be helpful. The 2 big treatments we're talking about are the remdesivir, which may be helpful in really, really, really sick patients that are dying on the ventilator, the last resort medication. That may be helpful.
And
I don't see people getting that the first day they get a fever.
Is that a medication, though, that's available to the public, or does your doctor have to prescribe
Well, it's got to
that?
be from a hospital. It's on protocol. It's like $1,000 a dose. It's a drug that was very expensive to create and found no home. So they're trying to find a home for this new drug. The other thing that people talked about is convalescent antibodies and taking someone that's had the infection, taking their antibodies and treating someone else with them. Well, this big study that everyone keeps pounding their chests about included 5 patients. 5 patients. Now, that type of therapy has been around since ancient China. China was peeling off scabs and feeding them to people or putting it in their nose and their mouth 1,500 years ago to prevent disease. You know, back in the day, that's how we figured out how to do smallpox. You know, we scraped someone that had smallpox, gave some of their blood to someone else, and then they wouldn't catch it. So that kind of antibody transfer from a healed patient to a sick patient has been around for 1,500 years. It should work.
Well, let me ask you about I want to go back, though, to elective surgeries and something that you mentioned about so many people who may need chemotherapy or who honestly, what about getting your, going to the OBGYN, and getting your test? I mean, things like that are not happening. And so do you think those things have to resume, and that could be a huge fallout from this as well?
The delay in people getting stuff that they are scheduled to get will cause problems down the road. No question. People putting off mammograms, people putting off colonoscopies, people not biopsying that suspicious mole. It's got another 2-3 months now. And so if there's a cancer, you're at a disadvantage, period. Cancer is only treated early.
And what is, and I know our time is almost running out, but what constitutes, when I think of elective surgery, I always think of, plastic surgery, something that you want done. But from what I understand now, elective surgery, can include hip surgeries.
Absolutely. Hip replacement.
Hip replacement.
A gallbladder, a breast biopsy could be elective. They're saying that hernias are elective, colonoscopies are elective. All those things that we have thought that were important to get done at a certain interval have been deemed elective. It's incredible.
It is incredible. It is incredible. Well, there's so much more I want to talk to you about, because I want to invite you back to talk about, since you also worked with the NFL, you'll have to come back to talk to us about, will there be football?
I hope so. I sure hope so
too. What is that going to look like? I
don't know. And because I can tell you whatever is the way it's going to look will not be based on science. It will be based on pressure, political motivations, and people worried about getting, just shamed. And so it's going to be, and I really do think that over the next couple months, there's going to be 2 categories of people, those with antibodies and those without. And I think there's going to be a hierarchy that those with antibodies are going to be a higher society than those without, because now these are the fragile people and these are the strong people.
Would you suggest, on that note, though, when all these tests become available for people to take the test for their own good?
The antibody test? Yes, I think that's helpful. But most people that have taken that test negative. Most people have not been exposed to it.
Well, in closing, Dr. Diaco, do you have anything else that you want to add? I know a lot of people are going to be talking about this podcast because, again, you have a lot of strong opinions, which I really appreciate you sharing.
Ask with boldness. That's all I have to say. Ask with boldness. Don't just be spoon-fed everything.
Thank you so much. Thank you so much for joining us. And in closing, everyone, one of my favorite poets, I always like to close with this: go where there is no path and leave a trail, just like yourself, Dr. Diaco.
Exactly.
Thanks so much for listening to Trailblazer, everyone. I'm Sarina Fazan.